Haileyesus Getahun today, who will be leading this. As you all know already, he is a global expert on this issue as Director of the Department of Global Coordination and Partnership on AMR at WHO. In this capacity, he's also Director of the Tripartite Secretariat on AMR that coordinates the joint work of FAO, World Organization for Animal Health, and WHO. Dr. Haile also has extensive experience in tuberculosis and HIV and has worked at the WHO for a very long time. So we hope that you're able to gain a lot from this talk, and feel free to ask Dr. Haile questions when he's finished. Thank you, Dr. Haile, once again for joining us today. We really do appreciate the time that you're taking to talk to us.
Thank you very much for the opportunity to speak to you today on AMR. And I don't know, what's the background of most. You said these are students, right?
Yes.
Audience. So are all of you are clinicians or beyond that? Just for me to shape the presentation well. What is the overall impression?
So I think most are medical students. If we have students from any other departments, we might have a few global health students also.
Okay.
If anybody else is here, then please drop it in the chat.
Excellent. Then in that case, I can share my screen, because let me see if I can do that. Can you see it?
Yes.
Excellent. So yeah, so what I'm going to talk about is about the public health aspect of antimicrobial resistance, and thank you very much for the opportunity and for your interest. The reason why I am putting antimicrobial resistance, even if most of you are medical students, passing through the clinical practice, but I strongly believe AMR will definitely be addressed by people like you who pass through the clinical training, but coming into public health. So public health will answer for quite a lot of our problems. So just to instigate interest in you. So the content of my presentation will be just to share what are the complexities around antimicrobial resistance, and of course before that I will tell you what it is, and then I will also highlight what are the basics to say something is of a public health approach. So I share that with you. And then I also share, as Aida said, I have been working for a long time in managing and directing and advancing public health programs in TB and HIV. So I will also share those experiences. And then I provide some proposed research questions to instigate some thinking as you advance in your career to take that forward for discussion. So with that, so antimicrobial resistance is defined as you can see it on this slide. And it is when the microbes, bacteria, viruses, fungi, and parasites, they change over time, and when they become non-responsive to medicines. So in doing so, infections caused by these microbes will be harder to treat, and also will help for, will also assist the risk of disease spread and also severe illness as well as death. And we know about antibiotic resistance, antimicrobial resistance, ever since we have drugs, medicines developed. As you can see here, Alexander Fleming is the person who invented penicillin, the first antimicrobial, which was a miracle during those days. But in his Nobel acceptance speech, he got Nobel for inventing penicillin. He already said that we cannot, if we don't use the penicillin with care, there is a risk that we may make it useless. So in terms of terminology, what antimicrobials cover is about antibiotics, those medicines against bacteria, antivirals against virus, antifungals against fungi, and antiparasitics are against parasites. So the most important thing is that we share all these antimicrobials with plants, humans, animals, and plants. I don't know how many of you are aware that actual antibiotics are also used in plants, in crops like rice and wheat, and also sometimes as pesticides. We use antifungals as well. So this by itself brings the challenge of antimicrobial resistance, because when these medicines are used not in the same level of concentration that they kill the bacteria, so the bacteria, when it is sprayed on plants, for example, or when it is given for animals, or when it is leaked into the environment in not good concentration to kill the bacteria, so the bacteria gets that selection characteristics to cause to drug resistance. And as you can see on this graph as well, immediately after the development of the drugs or the antibiotics, the resistance appear immediately. So how do antimicrobials develop, bacteria develop drug resistance? So there are 4 ways of mechanism. And of course, the development of drug resistance is very well known in bacteria. Maybe not in viruses and antifungal or antiparasites, but I think it's largely very well understood in bacteria, to some extent in viruses, but not in the others. But the overall mechanism, how the bacteria can actually develop drug resistance, is by these 4 mechanisms. One is by limiting the uptake of the drug into the cell of the bacteria, by basically blocking it. The second is by modifying the target where the drug would have actually acted and killed that bacteria. The third mechanism, they can also have the capacity to inactivate the potency of the drug. And the rest, where the fourth one is by pushing out the drug from the cell. So these are the basics mechanisms of how the bacteria, or possibly also the virus, how drug resistance is developed through these four mechanisms. So as I said, antimicrobial resistance is a complex problem. You can see it here. We shared the drugs between animals and plants. And also it's related to every part of the world, be it rich or poor. And also where there are also political, social, economic barriers. It's also linked to climate change. And also with the current pandemic, the COVID pandemic, as you may see from your practices, that there is huge use of antibiotic, not necessarily needed, and that by itself also goes into this propagating and amplifying the risk of antimicrobial resistance. So it is a complex problem that we need to address. So what are the drivers of antimicrobial resistance? This is simplistic presentation that antimicrobials, number one, they are used in all humans, animals, in the food and feed, in plants and crops, as well as in the environment. But the main driver is actually the lack of water and sanitation and hygiene. This is because of the lack of this, there will be lack of access to clean water. which means that there will be a risk of infection, a risk of transmission, and which in a way will also lead to the use of antimicrobials, antibiotics, antivirals, antifungals, and all these lead into drug resistance development. And similarly, humans, we use a lot of antibiotics, antimicrobials. So the misuse, and overuse, especially the non-intended use, will also enhance antimicrobial resistance. There is also the risk of poor quality of drugs. Some of the drugs are not of good quality, are not also affordable and accessible, which in a way will also lead to the development of drug resistance. So why? Poor quality, maybe, the potency of the drug could be at 20%, or it's falsified, or which in a way will not, enhance the killing power of that drug for that, microbe. Similarly, in animals, there is a lot of misuse, and especially in some settings, drugs, antibiotics, and antimicrobials are used for a practice called growth promotion. And this growth promotion is by feeding the animals, particularly for meat production, the antibiotics so that they can get fattened. And this is a very common practice, which definitely, of course, very much driven by the increased demand for meat in many settings. And the same food and also feed. Feed means the food that is produced to feed animals, pets or companion animals. There is also a lot of antibiotic use in those food. And as I said earlier, antimicrobials are sprayed for plants and crops as pesticides, so which also exacerbate. In the environment, mostly it is a discharge of waste from those factories and pharmaceutical plants that produce drugs, and there is a lot of oozing and leaking into the environment, again, with less potent concentration that leads into the development of the drug resistance. So now, what is public health approach? Public health approach has very simplistic, components. One is just what is the problem. We need to be very well aware of the problem. We need to identify the risk factors that lead to the problem, and we need to develop also interventions and evaluate them, and then scaling up those interventions. So basically, this is the cascade of a public health approach. And it has also inherent essential elements. One is that all our interventions and package of interventions should be driven by evidence and evidence-based data. We need to have surveillance, when we need to have also a standardized approach. And we need to be simple, and we need to be clear. So I think the simplicity and the clarity and the standardization, as well as dealing with surveillance and data, are the critical components for a successful public health approach. So this is just an example to show you how the public health approach of TB evolved over the years. And from three different strategies. The first one, called the dose strategy, that lasted for 10 years between 1994 to 2005. And then again, based on the experience, the scale up that was also developed between for another almost 10 years between 2006 to 2015. As you can see, each of this strategy has a package of interventions that are required. And now for the next, as a part of the Sustainable Development Goals, we have also what we call the NTB strategy. And as you can see, through this course, global surveillance and data really to inform the evolution of these policies is critically important. And this is also one of the beauty of TB, because it started in 1994 in very few countries with very few limited data, but throughout the course of the years, as a public health approach, since it has also that component of surveillance, today it's almost in every country, more than we receive data every year from 210 countries and territories. So this really shows how it is important to define the packages, to make sure that there is evidence, there is surveillance, and this is also taken forward for improving the strategy and helping this transformation. So another example to show you is that when you are clear, when you are simple, and there is all this progress, shortcut progress, this is just to show you how the public health approach for drug-resistant TB showed this spike at some point, and which is covering patients still today. And another important aspect of a public health approach is the standard guidelines, because as I said earlier, standardization important, so that standardization can be looked into the development of the guidelines. So this is really to show you a number of guidelines are developed by WHO that help the countries, and to ensure that between 2000 and 2019, 63 million people were saved from dying from TB. The same surveillance is important and good, so almost that experience, gradual evolution, helped in today that we have more than 160 countries which has drug resistance TB surveillance. Out of that, in 105 countries, it is actually monitored regularly through this existing system. So as I said, surveillance is an important component of a public health approach. So for HIV, it came after TB, but in the same way, it shows how standardization in diagnosis and treatment is crucial, and it also evolved. It started in 2003, 2004 with the initiative of WHO that was called 3x5, which was an initiative of WHO Director General, who has now died, J.W. Lee. When he became the Director General of WHO, he put a commitment of putting 3 million people living with HIV by 2005, and this was in 2003, in 2 years. And at that time, pushing that level of ambitious target was impossible, because antiretroviral drugs for HIV people were only limited in resource-rich countries, and they cost hundreds of thousands per year and thousands of dollars. So really having such a bold plan and target was a very important lesson for HIV that also helped to push the treatment. And today we have more than 26 million people living with HIV that are receiving treatment, but also millions and millions of lives were saved. So the same way like TB, the evolution of treatment standardization is also very, very, as you can see, over time, even in a much more rapid manner than the TB, because there is more evidence that was developed through the course of such public health approach that has been used to regularly update and change the guideline. Again, this also shows how the transformation and the evolution of the public health approach for HIV, because in the early days, antiretroviral treatment for HIV positive people was only prescribed by medical doctors. But through time, through this approach and through the simplification of treatment, through the research that has resulted in less toxic drugs, so the decentralization of services from hospitals into the lower health facilities like clinics was shifted, but also nurses could also prescribe this drug. So this shift of decentralization of services was important. So that is why, if you see, the rate of scale-up of treatment was huge, and it was able to achieve the plan of 15 by 15. And another essential component of a public health approach is to ensure that there is integrated laboratory. The diagnosis that we use for one would be used for another. So here you can see that what is called a gene expert platform, which was initially actually started when the US was hit by the following 9/11 in 2001. There was an anthrax attack in the postal office system. And during that, company was subcontracted by the Ministry of Defense of the US to develop a diagnostic tool. So they developed this gene expert to detect anthrax in the postal service. So this has later been repurposed to define TB using the same technology, and then which also goes into HIV viral load determination, and then into hepatitis. And now we are also possibly discussing the use for drug resistance detection. So really ensuring this level of platform is important. So the coming into the global action plan on AMR, this is a global basically policy that was started in 2015 by WHO that really shows the critical strategic areas, how the world should act around AMR. So the first is improving awareness and understanding. This is critically important. We need to make sure that the public is aware that they don't use, overuse, misuse antimicrobials. And then we need to have surveillance and research, and we need to reduce infection. And then we need to make sure that there is good stewardship for our medicines. And then, of course, money. And so what are the critical gaps in terms of research? I will just give you a quick run through. The number one is we need to really simplify how we are communicating about antimicrobial resistance. So I think it's a huge challenge. So we need more research to define that. And also we need to find a clear mechanism, because the figure we have is not very, it's not universal yet. So we are working in order to make sure that there are consensus around this data. But the information we have is that it is increasing, and it is, of course, a problem for both resource-rich and resource-poor countries. And another important point how to deal with is that what is the best way to garner more research. And one issue is that WHO has identified priority bacteria that are essential for research and as well as for public health intervention. As you can see it here on the list, we have 3 categories: critical and high and medium. And these are where if we don't act now to find treatment, to find the diagnosis, we will have a huge problem. And some people say antimicrobial is the silent tsunami and the silent pandemic. So there are a lot that we need to use. Another important point is that we need to be able to preserve antimicrobials and make sure that we protect their potency so that they won't be misused or overused. And data is also, as I said, coming from the animal sector, and we don't know much what is in the animal sector. So I think collecting that data is extremely important as well. And as you can see, the World Organization of Animal Health is the one that is collecting this data, but we need to ensure how we can use this data to inform our public health approach, whether there is a real link between the use in animals and also the public. Another important thing, as you can see from here, in many places, antimicrobials are used as a replacement for good water and good infection prevention. So ensuring that these basic infection prevention measures are available will help us to mitigate also antimicrobial resistance. So the other thing, as you can see here, antimicrobials can be sprayed on plants, but can we have different alternatives rather than antibiotics, for example? So this type of research will be important, and we need to also phase out and protect our extremely important drugs as listed on this slide. Another important point is make sure that we have good optimization or really good mechanisms and interventions to protect and to prevent the development of antimicrobial resistance. So this is, as you can see, from the research and development up to the post-market surveillance, that we need to see that there is good system of stewardship. And research prioritization is important, that we need to also address as part of the public health response. So in conclusion, AMR is complex. It requires comprehensive multisectoral response, and we have several public health programs where we can take the lessons and ensuring that there is good research and development and generating the data that is required for public health approach is important. And implementation research, we call it implementation research. This is the research, there are two types of research. One is really the development of drugs, the development of diagnosis, the diagnostic tools, but also how we are using those in an operational way. So that's also an important link that we need to discuss. So I think that brings a conclusion to my presentation, and I'm happy to hear any questions you have. Thank you.
Thank you, Dr. Haile. That was really informative. I'm sure everyone will agree. So if anybody has any questions they'd like to ask, feel free to unmute and ask Dr. Haile.
Yeah, I have a question, Dr. Haile. So as medical students, what we hear most about antimicrobial resistance is obviously from the prescribing perspective and from, not prescribing broad spectrum antibiotics. So how much do you think that could have an effect on reducing antimicrobial resistance? Is that something we should really be pushing towards as well as the public health approach?
Yes, I think that's a very good point. Yes, I think that should be a good way forward. So WHO has actually categorized all antibiotics, what we call the aware categorization of antibiotics. You can Google it, AWAERE, aware. So we basically categorized antibiotics into three categories. One is the access group of antibiotics, and these are the commonly available drugs like the amoxicillin and the rest. And the second group is what we call drugs which we would like to see watched, not routinely used. And the third is reserved for last resort treatment. So the target which we are working and a public health approach should embrace is to make sure most of the drugs used in routine clinical practice, if they have to be used, should come from the access group. This access group of category of drugs is number one, there is also less risk of developing drug resistance compared to those in the watch list and in the reserve list. So applying this categorization of drugs is also important. So I don't know how much is it integrated into your clinical practice, or also in your issue is always we go from the specific drug into the more broad spectrum. That should be the way. So the broad spectrum antibiotics are those either in the watch list or in the reserve list, which they are also under, since they are broad spectrum, the risk of selecting for drug resistance is also high. Yes, that is a good way forward.
Hi, Dr. Haley. I've got a question for you, if that's okay. Thanks for the fascinating talk. So the question I've got is, when we talk about AMR, most of the attention is on overprescribing and, compliance with the medications and stuff. But I was wondering whether anything's being done to address the sort of access issue and inequity, because I think according to the UNICEF reports, approximately fewer than 1 in 3 children with like a suspected pneumonia actually receive antibiotics when necessary. So if you could just share your thoughts on what the impact on those populations are, that would be great. Thank you.
Yeah, I think that's a good point. As I mentioned in my presentation also, the access of affordable and of quality drugs, medicines is essential. It's an essential tool actually to prevent antimicrobial resistance. And as you rightly said, there are actually every year 6 million children die because they don't have access to antibiotics, which means really huge. It's not, when we say access, it's about quality. It's about getting a drug that is working. And there are a lot of measures that could also be used to mitigate this problem. And one is around regulation and making sure that these drugs are quality checked, and also particularly by monitoring the free sale and exchange of antimicrobials, particularly antibiotics. But as you all know, it is always difficult to have a legislation and also to enforce that legislation because it goes with having a strong enforcement system and to the court system, into the police system, and all the related issues. So that has always been a challenge. And the other solution could be to make sure actually that antimicrobials or antibiotics particularly are part of basic human rights, as just like any health care, to ensure that whoever needs them, he or she should get it. And then taking this in the context of universal health coverage as part of everyone's basic right could be a good way. And as you know, WHO is really pushing hard for universal health coverage, and having quality drug is an inherent part of that. But this is always a divisive agenda because it's a lot of ideology behind it. In some countries, there is pressure and push that such public, good, making health as a public good is always debatable in some countries.
I had a question as well. How important do you think it is to manage antimicrobial resistance in the food industry and food production compared to sort of like in hospital and the clinic scenario? And how much power do you think, or how much influence do you think we have on that?
Yeah, so I think that's an excellent question. The food industry and the animal production use quite a lot of antimicrobials, and some data, if you go and see the US Food and Drug Administration website, you will see the amount of antibiotics used in animals. They report it on a voluntary basis, and there are also some data up to 60% of the use of antibiotics is actually in the animal sector. So definitely the overuse and misuse is there, but at the same time, if you talk to the animal sector, they say, no, the misuse, the overuse is also in the human beings, which is true, because whenever we have flu, if we use antibiotics, knowing that it is a viral infection, but with the assumption that, oh, in case it is a bacteria, I need to take this antibiotic and protect myself. So that's overuse for something that is not, needed. So in a way, this is a conversation that we are having. So one thing which we do when Ida introduced me, she said, I am also director of the Joint Tripartite Secretariat on Antimicrobial Resistance. So the tripartite are these three organizations: WHO, the Food and Agriculture Organization of the UN, and the Organization of Animal Health. So each of these organizations, WHO is of course responsible for the human health side. FAO is responsible for the food and agriculture, and OIE is responsible for the animal health. So as part of my day-to-day work is to ensure that these sectors are coordinated and are actually and then we work together to make sure, rather than finger pointing to each other, we say, okay, what is our common goal? Our common goal is to make sure while the antimicrobials we have are preserved, that they continue to be potent, that we don't lose them. And that is of great advantage to the animal sector and also to the human beings, because animals also need a drug that is working, just like humans also need. So I think we are really establishing that sort of rapport to make sure that we have a shared goal and a shared vision that we work together. The situation may be different if you ask me 5 years, 4 years ago, but at least now there is increasing understanding that we need to work together, we need to address it together. Because if we only focus on the human side to address antimicrobial resistance, it is like clapping with one hand.
Thank you.
I also have a question, so if that's okay.
Yeah.
Thanks again for the really interesting talk, Dr. Haile. So my question relates to the fact that in many countries, antibiotics are freely available without necessarily having regulation. I know people can get them directly from pharmacies and also, say, from street vendors in the markets. So I just wondered if you have any ideas about how we can tackle this issue and if anything's been done from the WHO.
Yeah, I think the over-the-counter sale of particularly antibiotics is a huge challenge all over the world. And putting regulation is a way forward, but as I said earlier, putting regulation is not an issue, but enforcing the implementation of those regulations is the biggest challenge. It goes with resources that the country has. It goes with understanding of the public, the education status, and also the concern and the need for protecting our future. So many socio-political issues come into play. So it's a big challenge. It's a big challenge. But what we are trying to do as WHO is we are working closely with drug authorities, in many countries to ensure that the drug authorities have some sort of keys to make sure that this, imposing these legislations, imposing these regulations, but also be enabled to advance their implementation. But again, it is all about food security, ensuring and making sure that also we prevent deaths in some situations. So I think all those issues play, but at the end of the day, it is about how do you call it, the enforcement of the rules, which is always a challenge.
So, Dr. Haile, something that you alluded to in your presentation was the development of new antibiotics. And there's a lot of reasons why pharmaceutical companies might not want to invest in that. So actually at King's, we have an association where we advocate for the development of different drugs and the accessibility all around the world. So it would be interesting to hear from you why more antibiotics aren't being produced. They haven't been produced in such a long time, and what can be done to get over this, maybe. financial disincentivization?
Yeah, so in one of my slides, I showed the evolution of development of antibiotics. So antibiotics, I know the last class was developed 30 years ago, but immediately after the invention of penicillin, and immediately the 2-3 decades after that, there was a lot of research and development. Antibiotics, different classes were developed, and they were really the markets, the money making, discoveries for the drug, pharmaceutical companies. All those big companies today that actually exist, the research and development of antibiotics actually become rich and big because of the sale of antibiotics during those days. But with time, and also with availability of more, how do you call it, profitable therapeutics like anti-cancer drugs or anti-hepatitis or all the other, where there is interest to invest, and or where there is also market. So they gradually exited the research and development, and they focused on the more profitable and money-making medicines. So this is a huge challenge. The market is broken. Antibiotics are not anymore of interest to the big pharma. Of course, there are some companies which still invest in the research and development, but different initiatives are being advocated, are being suggested to address this challenge. One is how to keep the private sector incentivized, and the other thing, even those new antibiotics that are being developed, we would like to keep them in the reserve category. Don't touch it. They should be like the last resort for our infections. In doing that, what we are actually also doing is that the target of those new antibiotics is the population, or is very, very few, because it is not a routinely available infection, because those are very drug resistant infections. So we want to preserve them rather than using them for simple infections. We want to keep them. So by doing that, we are also restricting and limiting the amount of market or the size of market that these drugs and the pharma companies benefit. So I think this is also another challenge. So that's why now there is a really ongoing debates and discussion that governments should pay for it. There are different ways of incentivizing, what we call push mechanism and pull mechanism. Push mechanism is something like you pay for a product and you push it up into be more productive and more going into the market through the clinical trial. So basically you invest in the research and development. There are agencies running that, so that we call it push incentives. The pull incentive is also the other way. You just look around and you try to pull by showing money. So all the agencies will do whatever they want, but you say, okay, at the end of the day, I put $1 billion for any antibiotic that is being developed by anyone. So you try to pull from whoever is doing the best one through that. So there are these mechanisms that will likely help, and there is discussion among the rich countries, the G7, and different countries have also different ways of incentivizing, but it is not standard, but it is a challenge. The challenge would be why a government, how someone can convince his or her member of parliament, okay, to invest into a private pharmaceutical company where they are making quite a lot of money in anti-cancer drugs, for them to make more money for the less profitable antibiotics. So this is a really tricky situation where we are now. So it's a very complex topic where we are in a huge struggle.
Thank you. Do we have any other questions? Okay, in that case, let me just end on one more thing. As students, as medical students and other allied health professionals, what can we do today and in our future careers that can help prevent AMR? I know we've spoken about limiting unnecessary prescriptions, but what else can we do to make an impact?
Yeah, so what can you do today? I think always when you prescribe drugs, be it for your patient or for yourself, just ask, do I really need this? Number two, I think this is also should be the tenet of your career, as clinicians. I worked as a doctor in a very rural, remote health center in Ethiopia, and where we have a huge, difficulty of access to, drugs, So sometimes you should also, treat the patient. You will be forced to treat the patient because they want to get antibiotic, because they know they want you to prescribe antibiotic, or they want you to give them injection. And because in the communities I served, injection has that potent power of curing, the treatment. So in such instances, I think we need to always, remember and say that, do we really, do this patient needs that antibiotic or antimicrobial? So during my practice, what we used to do, because we know the power of injection, sometimes we treat them also psychologically. So we give them anti-pain injection and they get cured. So I think that type of modality and creativity is also good in order to preserve, our drugs. And the rest, I think you are all young, and the future is in your hands, and antimicrobial resistance is the next tsunami, the next pandemic, and it is actually an enemy working in the background, and we are not, taking it. And we are saying it's all about the future, but it is of course a current problem, but the challenge is for the future generation like you. So what you can do is always think there will be another COVID, and you see how COVID disrupts our lives. And especially the effect is huge in like young people like you. And it will be permanent, of course, the effect. But remember, in your lifetime, there could potentially be another. And to prevent that, always think antimicrobial resistance. Thank you.
Thank you so much, Dr. Haile. We learned a lot this afternoon, so thank you for sparing the time to share your experiences with us. Yeah, all the best.
Thank you very much. Thank you for giving me the opportunity. Thank you.
Thanks.
Bye-bye.